Hi everyone, I'm Dr. Tuhina
And I'm Dr. Sneh.
and we're here to help you with all your dental questions and doubts that you may have and probably haven't spoken to your dentist about. So, to know more, continue watching and subscribe to Moms Know Best. Dental care is not just about not getting cavities or going to the dentist only when you have pain. Dental care essentially is thinking about yourself, your teeth as a part of your entire body until the end of your days. Until, suppose you live to 1995, you still want to have a good set of teeth to eat with. So, the sooner you start, the more sure it is that you may not lose your teeth. It is not necessary to wear dentures with dental awareness nowadays.
And the very important aspect of dental care is not just avoiding sweets or chocolates. Very important aspect is the home care aspect of the dental care. The brushing twice regularly, which we'll elaborate upon further. The technique and all is to be followed precisely. Flossing, mouth rinsing after every meal. So all that is really important. And apart from that, visiting your dentist every 6 months, that is something that I would advise. It should not be more than 6 months after the first tooth erupts, which is on an average about 6-7 months of age. So just keep on looking for those teeth erupting in your child's mouth, and you can probably just come after that, right after that. And don't wait up till after the first birthday of the child. It should be done before that, because there are certain things that you need to take care of, probably if the child requires any preventive aspect to prevent any cavities.
Yeah, because dental problems can start as early as 7-8 months of age as well, which people don't realize. So it's just a short dental visit, it's not really interventional, but you should probably take your child to the dentist before their first birthday. Once your dentist has seen you, your dentist will tell you whether you need to come every 6 months, whether you need to come every 3 to 4 months, or there are some patients that, we're sure that their teeth are absolutely fine and we can even advise you to come in once a year, but only your dentist can help you out with that.
It's essential that you start cleaning the kid's teeth as soon as it erupts, the first tooth that erupts. As I said earlier, it's about 6-7 months of age. So watch out for it. Start cleaning it. Obviously, in the beginning, you may not be able to use the standard brushes which are available for the kids. So what you can do, you can buy those silicone tipped brushes which fit on the mother's finger, and you can use the softer brushes to clean the child's teeth, because it's delicate in the beginning. Obviously you don't want to irritate the child. And so toothpaste, I think you can start using it from the beginning, that there's no harm. It's recommended. Earlier there was a concept that you do not use fluoridated toothpaste, but now you can start using normal toothpaste as early as possible. There are kiddie toothpaste which have a lesser fluoride content, so they can be used over the counter. They are available very easily.
And it's a lot of mothers think that abhi to daant aaye nahi hai, like there's just one tooth, why should I clean one tooth? But that one tooth also matters, and it doesn't take much. So you can either wait till your child is asleep or a little less restless, and then simply use that silicone brush. You'll get it at any chemist, and you can simply use it to just wipe the inside of your child's mouth. And another very important thing, obviously, to take care of, because your baby's immunity is not very high, is you need to make sure that you keep everything sanitized. You need to boil the silicone brushes or whatever the instructions are. So make sure you keep it clean, and after every use, it has to be cleaned. So this is something that we face on a daily basis. It's one of the biggest problems we face in our practice. Most of the times, a parent will come and say, it is a doodh ka dant. Why should I bother? What you don't realize is that your milk tooth and your permanent tooth are in this sort of a position inside the child's mouth. So what happens is that even though your milk tooth is coming out, the infection that forms at the bottom of the tooth can affect your permanent tooth. So once your permanent tooth finally comes out, it's highly possible that that tooth may get infected. Secondly, it's not necessary that just because it's a milk tooth, it'll get decay or a cavity and it'll just fall off. Every tooth has a different age at which it falls. Certain teeth don't fall until the age of 11 and 12 years of age. So suppose your child gets a cavity and an infection on that tooth when she is 6 years old. For 5 years, that tooth is going to be decayed and it's going to be a site of infection. And infection can flare up at any point. We've seen kids with swellings, like parents ignore it, and then after about 2 weeks, they report as an emergency. Very recently, we had a parent come in at 9:30 in the night with a child with, the cheek was swollen. This is just because even, after the dentist explains to you, I think even as a parent, probably I may think the same thing.
Somewhere it's been drilled in our minds that, it's
doodh ka daant.
It's going to fall off. But that is what it's going to last from 1 year till 11, 12 years of age. So you don't want the child to be subject to a chance of infection underneath. On an average, it starts falling off at about 6 years of age. Even if it is delayed a bit, then no need to panic. It can vary 6 months, 1 year. What you need to watch out for if a new tooth has started erupting, the permanent tooth has started erupting and the milk tooth has still not fallen off. So that is a cause for concern because that can lead to your teeth being crowded at a later age of life.
It's something we call double teeth. If you see a double tooth in your child's mouth where the milk tooth is there and then you see the permanent tooth coming, don't wait for the milk tooth to fall on its own, because if it takes a longer time than required, your permanent tooth's position will be crooked. Also, for a proper sequence of at what age which tooth should ideally fall, with the internet nowadays you can download that chart anywhere online. You just have to Google milk teeth eruption sequence or milk teeth sequence of teeth falling.
Teeth eruption sequence. So that is when the milk teeth are supposed to follow. So the age is variable, but what matters is the sequence. So your dentist should be able to tell you if it is going online or not.
The most common symptom is pain. Nobody goes to a dentist unless they have pain. But don't wait for pain, because when you get pain, the treatment gets more complicated, more expensive, which is a problem for almost everybody. But you should probably get it checked at the first sign. If you feel sensitive, anything different that's happening in your body is happening for a reason. Your teeth are not going to suddenly start responding in different ways for no reason. There's going to be either sensitivity, there's going to be mild pain. There are patients who will come and say, I have very little pain. It's not so much that I need to visit a dentist. When it's so much, your treatment also becomes worse. Even at for different people, the signs and urgency of visiting a dentist is different. So, particularly if you are a diabetic, if as a pregnant woman, some women get gestational diabetes. If your blood sugar is high during pregnancy or even without that, normally during pregnancy, any changes in the gums, do not consider it normal, because your hormones go completely crazy and that can be one of the major causes of changes during pregnancy. So that can be something that you really need to take care of. So don't skip a visit to the dentist just because it's a minor change. Normally, I think the symptoms that you would have to look out for are if your child's eating or drinking habits change all of a sudden. Not all kids are vocal about it.
If the child is chewing from only one side, or he prefers not to eat normal roti sabzi, then that is something that you can watch out for. If the kid is not very vocal with his pain, then you can probably look out for that. They come and question if the tooth which I'm seeing, which is appearing black, is that a milk tooth or a permanent tooth. So their decision is already set in their mind, but should not do that.
If your child's habits change to an extent where the child doesn't want to drink cold water, the child starts saying no for ice cream, because sensitivity is something that kids face, but kids cannot distinguish between sensitivity and pain. So the child will start behaving in different ways when it comes to this. So you need to look out for that. Secondly, at whatever age it is, you need to get your child accustomed to a routine dental visit once in 6 to 8 months.
Also, I would like to add here the home remedies that you mentioned. So the home remedies will give you what we call symptomatic relief. Pain being a symptom, so it will simply numb down the pain. But in longer terms, for the time being, it will numb it down. But then if you wait it out for 1-2 months, then the pain may return in a more severe fashion.
You're not treating the cause. So you need to
if the infection goes in deeper, basically.
Yeah, so normally kids with special needs do require a bit more attention. And we have a lot of options. There's something called conscious sedation, where a child with special needs who may or may not be comfortable in an environment which is a bit scary to him, So it becomes difficult to treat them that way. So there's something called conscious sedation, where we have a team of specialists, and they will come in and they will help out with whatever treatment the child requires.
So essentially, a child with special need may require more than routine number of appointments, because he will take time to get used to the entire setup. But once he's used to you, they become some of the best patients that you can treat.
And particularly with children with special needs, what we try to do is, at the first visit, we don't do anything. We simply sit and talk to them. So the child starts trusting you. So that is very important. It has to be someone you trust. It has to be someone that you and your entire family trusts. With a dentist, you cannot, it's something that in our dental circle we call shopping. We have a lot of patients who go shopping. What happens in that is, ultimately you're going to a doctor. Until and unless you have a certain level of trust that is established, you cannot possibly have any good successful treatment. So that has to be the
And
primary
essentially
thing.
all doctors have been trained the same, so as it goes back to it. So one doctor may give you a slightly different opinion than the other, but there's nothing wrong with that. It's everyone's following their own experience, their own teaching. So that's pretty alright. The goal is the same, the path may be different.
The most important cause of gum bleeding is plaque and tartar accumulation. It is again because everyone skips that once in 6 months, once in a year visit to the dentist. You need to keep getting your teeth clean. It's a part of your body. If we go for, you have a bath every day. You maintain every other part of your body. So you need to make sure you maintain it as well. In fact, your mouth is it's the part of your body which is the most in use. You eat, you talk, so it's constantly in use. So you need to take care of it. That is the biggest problem. Secondly, like I said, hormonal changes during puberty. If your child, the minute your child hits 13, 14 years of age, if they start getting gum bleeding, it's could be because of hormonal changes, pregnancy, lot of other factors. So the minute you notice that your gums are bleeding during brushing, it means there's something wrong. Something else could also be an underlying disease which is not so common in kids, but as an adult you may need to get your overall body health checked out if you suddenly develop gum bleeding. The treatment is very similar. You will always start with cleaning the gums. You will always start with removing the bacteria and dirt accumulation, and then after that a more long-term plan can be established.
A tooth, it could be either chipped off or it could have come out fully.
Yeah.
In either case, you try and save the tooth. Do not delay in visiting the dentist. If the child has had a trauma, then take him immediately to the dentist, because if the trauma is severe enough, the child may need some immediate attention. Otherwise, the tooth may die out. And
very recently, we got a call from a cousin at 10:30 in the night saying that my child fell down and he's broken his tooth. So, is there anything to worry about? Because the children they will get hurt in the entire mouth area. So the first thing to do is to stop the bleeding. Yeah. The first thing you do is get an ice pack or anything cold, and just make sure that the bleeding in that area stops. Whether it is the gums, whether it is the lips, whatever it is, make sure it stops. Secondly, you need to save the tooth. Yes. Even if it is a part of the tooth, like just a chipped part, look for it, find it and save it.
If the tooth has come out fully, then you cannot keep it out in the open. Then you need to store it in some kind of a medium. Milk is one of the better options.
Yeah, and the most available, I think.
The most available in every household. You can also use normal saline, which is available at any chemist. So you can just buy that and store the tooth in that until you visit the dentist.
Yeah, so
but it should not be delayed in general. Like take the child immediately, because each minute matters if you want to save the tooth.
Because it is possible to replant a tooth. There is such a thing where if the entire tooth has come out, we can put the tooth back in if you come to us in time.
First and foremost, there is no ideal age for braces. Braces can be done at any age, even adults at a much later
even
age.
50, 60, it doesn't matter.
Yeah, it doesn't matter. But ideally for kids, if you're asking, then the first orthodontic appointment, the first orthodontic consultation is to be done at 7 years of age, because there are certain type of problems which, if detected early, it can absolve the need of braces at a later age, or maybe reduce the amount of work that needs to be done later on.
And also, you need not actually have a problem to visit an orthodontist. At 7 years of age, in general, you should go and visit an
orthodontic consult
orthodontist.
should be done. And so braces, there are different varieties for braces. The routine thing that you see anywhere is this metal braces. Okay, but there are other options available if you are very conscious about not putting your teeth under that duress. There are something called ceramic braces which look something like this. So if you see them from far, I'm not sure if you can catch it on the camera, but they are not that visible. There are other options called lingual braces, invisible braces. So the lingual braces go to the back of your teeth. So essentially, they are not really visible
on the inside.
On the inside,
outside.
yes. And there's something called clear aligners. So
that's the newest thing in the market. That's what's trending. They're called invisible braces. So what it basically is something like this. It simply snaps onto your teeth. So what you'll get is something like this. And
it's a series of these plates, and minor tooth movement is planned in each plate. So it's basically a removable thing. It's more comfortable.
And I don't think there's any difference in time duration of treatment.
No,
is there?
It's near about the same.
About the same.
Yeah.
We've actually argued about this because as a child growing up, I never used a tongue cleaner. I didn't know that there was such a thing. And he's used a tongue cleaner since...
I've grown up in a Gujarati household, so
so he's always used a tongue cleaner. But it is recommended, definitely. Although the metal tongue cleaners can sometimes cause injury, so sometimes, probably you should look for a plastic one. But
yeah, it should be done. So oral hygiene is not simply cleaning and brushing your teeth. It is, encompassing the entire mouth. You have to clean your gums, you have to clean your tongue, everything.
And this has to be passed on to your kids as well. So if you have an infant or, a child below 4 or 5 years of age, if the child is not comfortable with a tongue cleaner, what you can do is you can buy gauze. You'll get gauze at any chemist. Cut pieces of it. Take a thick piece of gauze, wet it a little, and simply in one swipe, just clean the child's tongue. You can do it early in the morning. That's the most preferable. And so that saves a lot of problems of bad breath that can happen in kids as well. How to make him brush? He doesn't sit. The child doesn't open his or her mouth. So that's the biggest problem is compliance with kids because kids don't listen. We've seen kids who just refuse to open their mouth. I had a patient who the mother actually said would not stop brushing because the boy was about 4 or 5 years old and the whole day all he would want to do is just like datun. He just want to keep chewing the bristles and constantly brush it, but that's also harmful because that starts abrading your teeth. So you start losing good enamel. So that is genuinely the most common question. And I think control on chocolates. Yeah, so how often can a child have chocolates? How often can a child have chips? And so essentially a child, in their early ages would probably be either breastfeeding and then after that bottle feeding. So firstly, you need to take a lot of care about your child's mouth hygiene when the child is feeding. A lot of mothers have a habit of feeding the child as the child sleeps in the night. So fine, that's probably the easiest way to get the baby to go to sleep, but you need to also make sure that if possible, if the child has started having water, then at least give the child a little bit of water after that. Try to keep the mouth clean as the child sleeps, particularly if you're breastfeeding after the child has got a few teeth, because some babies do feed until they're almost 2.5 years of age. So you need to take care of the teeth.
Even before that, you can use that wet gauze trick to clean around the gums of the kid. Even when the child is a baby, it doesn't matter. You have to keep on cleaning the mouth. Another problem that you may be facing in that age range, that would be habits like thumb sucking. So thumb sucking is a very natural thing for a kid to do. Of course, it gives them security. So up till about 3 years of age, it is quite normal for the kid to have that habit.
And up to then, it's not very harmful.
No, so basically after 3 years, that is when the permanent teeth start to develop. So you don't want the thumb sucking habit itself can lead to your teeth sticking out and all the other problems. Once the child has crossed 3 years, it's a good idea to start weaning them off the habit. Some good ways to do it is you either do it calmly. Initially, you begin with just taking the child's thumb out when the child is asleep. So at least subconsciously he's not doing it.
Karela?
Yeah, so you can
That's
so
what
you
a lot
can
of
probably
mothers do.
use some bitter thing. Hing, you may not like that,
Yeah.
but you can use some agent on the thumb or whatever if the child is sucking on a
And
finger.
this is all homemade,
Home
right?
remedies,
So it's
yeah.
not harmful to the child, even if the child eats it. It's
A kid, if he has any problem in his mouth, if he's not able to breathe normally, the child may develop a habit of breathing through his mouth.
yeah.
So mouth breathing is common. All of us do it whenever we are exhausted. We have had a job, but
have a cold.
but if the child is doing it actively, then it may be a cause for concern. One simple way to test it is you ask the child, take a glass of water, ask the child to take a sip and hold the water in his mouth. If the child is not able to hold it beyond say 45 seconds, 1 minute, if he spits it out or swallows it immediately, that means your child is probably breathing via his mouth. That may need some kind of intervention, dental intervention.
Also, another way to check it is if your child has very dry lips, especially in the morning, if there's complete drying of the mouth, so just keep a lookout for these kind of signs.
Yeah, and
And this leads to bad breath. Biggest mistake is that if the child is crying and fighting,
yeah.
they just let it be.
yeah, don't do
They
that.
just leave it.
It will require some patience, but the best method would be probably using the method of reward, like you. So what one of my patient's mother does, she has an assortment of toothbrushes. He's a big fan of Avengers. So
Yeah.
there's a Hulk day, there's a Captain America day. So you can work out whatever your kid
So
likes.
the child can choose
So-
which toothbrush he wants to use
Yeah.
on that particular day, or you have these frozen toothbrushes now, so you can be Elsa or you can be
Yeah,
the
yeah.
snowman, or
Important is doing it daily.
there are these really fun germ videos where on YouTube you can get these videos where you will have the germs in the mouth, and there are all these bacteria and demons in your mouth, and come on, we have to fight the demons. And also we do use that in the clinic as well. When we have kids, we've got our screen above the chair, so we've got those videos. Then the child gets scared that, oh, there are germs in my mouth. So it's a fun way to sort of at least scare the child of the germs in the mouth, so the child himself wants to sort of fight the battle and get it out. And for girls, I think girls are a little easier to deal with, because they're more easily distracted and they're not so hyper. They're a little calmer, so I think girls are easier to deal with in that sense. Yes, mouthwashes are definitely very good.
But I would like to add that you should not use them for kids under 6 years of age, because they haven't developed the dexterity. So there's a tendency to swallow it.
Yeah, kids can't. A lot of
Yeah.
kids don't understand how to spit.
So it's a good supplement, but it's not a good substitute.
So yeah, we do have a lot of patients who are switching to Ayurvedic pastes of late, because it's very trendy right now. There's nothing wrong with it, but we have seen quite a few cases of patients developing allergies. So there's absolutely nothing wrong with it, but just make sure that it suits you. So the minute you feel any changes in your mouth after switching a paste, not just from commercial to Ayurvedic, but from any brand,
One brand
to
to
any
another
brand,
brand,
yeah. Just make sure that you're comfortable with it.
A toothpaste is basically just a medium of brushing.
Yeah.
More important aspect is the actual brushing part. So it doesn't matter what toothpaste you use.
Yeah.
So the time period, I would say from about 0 to 7 years of age, that is when your teeth are actually developing within your bones. So milk is a very rich source of calcium, as it's very commonly known. So I would say the other products maybe are not as rich as milk in calcium. So it's essential that at least during growing years you give proper milk to the kid. It would work out in favor.
So one of the biggest causes of sensitivity is brushing too hard. Sometimes what happens is that we don't realize it, but in the effort to keep our teeth very clean, we use hard toothbrushes, which actually start removing your natural enamel. So some people inherently have very thin enamel, which is okay, but many times it could be natural, and it could also be caused by brushing really hard. That is one of the main causes of sensitivity. So that is something that is very commonly done by parents.
Yeah. So, matlab, you scare the child, but then we have to face the brunt. So don't do it. So what is more essential is that the kid has to develop a positive attitude towards dental treatment. Dental treatment nowadays is very comfortable. You know, you get proper anesthesia. Even before anesthesia, you get a pre-anesthesia. So there's nothing to be worried about. Try to inculcate the same habits in your child. If you are visiting a dentist, it's a very good idea to take your child with you so that he sees you being treated. You know, so he gets inspired. Okay, if my mom or dad is, you know, getting dental treatment, then there's no problem in me undergoing the same.
Yeah. The child needs to understand that being at a dentist is a safe place. No one is going to unnecessarily hurt the child. So when you scare your child, you're essentially putting that fear inside the child that this person is going to hurt you. So obviously at a point when they actually need treatment, they're not going to be happy about it. Also, kids bite. We've had kids bite us as well in the clinic, because if they don't like it, if you just put your finger or you put something into their mouth. So that is another big challenge that they face.
Some kids tend to not spit out the slurry, so they tend to swallow. So
you know, these companies, they make sweet, nice flavor toothpaste, but the kids like it.
The kid
so
doesn't know that he has to spit it out, right?
So yeah, so
you
very
have to teach it. It takes time, but you have to teach it to the kid.
And the amount of paste that you use, actually,
Oh yeah. So no need to take a full length of paste or even a pea size. For a kid, you can take hardly a grain size paste.
Like the size of a rice grain. That's it. That's all you need for a child below
Once
the age.
he's got all his teeth in the mouth, all his milk teeth, that is when you can probably move to
about 4 to 6 years, you can start using a pea size. About
3 to 4 years. 3 to 4 years, you can start using a pea sized amount. So I'm Dr. Sneh. This is Dr. Tuhina. If you like this video, please share it ahead and subscribe to Moms Know Best.
Because moms do know best.